What were you here for before?
It was for
That's awesome.
it was I believe HLH. It was HLH related. Like it was my autoimmune disease related.
Okay. So it's probably been a while then since.
Yeah, it has been.
Yeah. And you've been following with Dr. Powers at North Bay, right?
Right.
For the HLH.
Yeah. She's been my oncologist from the time I got sick up until now. So she's been the one that's been monitoring my my progress with that.
Yeah, I saw I got records of her notes and everything. It looks like she's been following you very closely.
Yeah.
So my understanding is you're being worked up for a possible kidney transplant.
Yeah, I'm doing the workup in March.
Okay.
So, yeah, they're gonna be doing a workup on me. But the last time I was here, I was told that the HLH might be a factor. They were saying that if there's a possibility that the HLH could flare up again, then that could disqualify me from a kidney transplant. So that's what led to the referral for today.
I see.
Yeah.
From what I read, Dr. Powers last saw you in January, I think.
Yeah.
Pretty recently.
Mm-hmm.
It looked from her standpoint like she didn't see a reason why you shouldn't proceed with the kidney transplant, because from the HLH standpoint, it seems like things have been stable, like you don't have any signs of active disease or anything. Is that your understanding as well?
Yeah, that's what she said. Her logic is because if I were to get the kidney transplant, like if they were to move forward with it, because I'll be on so many powerful immunosuppressants, that it'll suppress my immune system, which won't, which theoretically shouldn't activate the HLH.
Right. Yeah.
Which
I kind of follow her logic, because I know you were on the cyclosporin for a long time, as part of the HLH treatment, and then you've been off of that for a while now.
Yeah, I've been off of that for a long time now.
Okay. Yeah, it looked from the records like you've been off for over a year now off of the cyclosporin. Does that sound right?
Yeah, it sounds about right. That sounds about
Okay. How have you been feeling overall?
As far as what?
Just in general,
like physically or emotionally, or
but both physically. I mean, emotionally is also important.
I guess physically. I mean, on paper, I'm fine. As far as the dialysis, I'm fine according to that. I'm following. I'm staying within the parameters of what they need me to do. I'm staying within the parameters of what they need me to do, and fluid restriction, dietary restrictions. I'm doing all that. There's no major problems because I'm doing what they're telling me to do.
Sure.
And I'm doing research on my own and what I can eat, what I can't eat, how much food I'm supposed to be drinking. Little things I can do. But physically, I mean, some treatments go really well, and then sometimes some of them really don't. Yesterday, it was really bad. It was really bad yesterday.
Your dialysis treatment?
Yeah, afterwards, it was just I felt terrible afterwards, and for the rest of the day, I was just I was done after that. And I'm still sort of feeling the effects of it now.
Sure.
But I mean, as far as emotionally goes, that's a whole thing. It's just I'm gonna be completely open with you. I hate dialysis. I don't I do a lot of research, to sort of okay, what is everybody else doing? What is everybody else, what do I have to look out for? And I've noticed that the general consensus is that you're supposed to fall in love with dialysis and just love all this stuff. And I didn't need dialysis to like teach me any life lesson or like make me a better person or like
Yeah.
you know what I mean? Like I didn't need dialysis to
No,
like make me appreciate, you know, my mom or my friends. Or I didn't need any.
You would rather not be on dialysis, of course.
Right.
Yeah.
Like I was doing all this stuff, like I was soul searching and all this stuff, and like telling my mom I love her every day. Like I was doing that before. Like I didn't need this, you know. And it doesn't make me a better person. Cause I was already under the impression I was like a nice guy before this happened. So, you know, like it's hard. And it's difficult to talk to people because they're just like, well, you need to just shut up and just be happy about this. Or just accept it and just move on. I'm like, I'm only 36.
You're so young and you've already gone through like a huge thing with the HLH too.
Right.
So.
And that's something that a lot of people don't know.
Yeah.
Especially at my clinic because they don't ask me anything about myself. So they don't know that there's like this whole part before I got to this point. You know, like I didn't just like, you know, party myself into dialysis, you know, like I was sick with something else that like almost killed me beforehand, you know, and then I had to go through the chemo and then that immediately transitioned into this. I think I could accept this more if there was like, if I had like at least 5 years in between, you know?
Sure. No, it was kind of two huge things back to back for sure.
Right.
And then dialysis is also a huge time commitment, like 3 days a week.
Yeah, and I can't do, you know, I'm not like, I don't got like a six pack or anything like that, but like I was a relatively, you know, pretty active guy as far as like training, like, you know, physical training. And now I don't have the energy anymore. Like I can't really do it the way that I wanted to do. Well, I want to do it, you know, but I'm just supposed to just accept it and just like, hey, you know, like this whole thing started when I was 33. I was 33 when this whole thing started. So when I got sick with the HLH, I was 33. And now I'm 36. You know, so like I was sick that whole time.
It's a long time, especially when you're like when you were very healthy and active and everything.
Yeah. And then my life and it stopped. Like my whole life stopped. You know, and then, you know, I get like these people that try to like these people in the medical, you know, medical care keep trying to tell me that, you know, like it's just I just need to just accept it and just like move on. But I'm like, well, I went from a perfectly healthy person just 3 years ago to not a healthy person, you know, and I'm not like, how am I supposed to adjust when I'm literally in my like physical prime? Like I feel like I'm just like wasting away on this when I could be using that time, you know, to get strong. And I spent so much time, like I used to do martial arts and I spent like 7 years like making myself strong, and now I'm not strong anymore, you know.
No, I think it's just hard for other people to understand what you've been through. Like you're the one that's been living it, and it's really frustrating when people obviously offer judgments when they're not the ones that have been dealing with all of it.
Right. I noticed that, you know, it's like they get to clock out and go home, you know what I mean? And like I can't clock out from this, like I can't.
No, you're still dealing with it.
Right. And they're like, oh, well, maybe you can find something else to do. It's like, well, I mean, there's really not much else I can't, like, this is like every day, this is my life, you know what I mean? Like every day I spend 12 hours on my week here at the clinic, you know, at the dialysis clinic. It's every day. Like I think about it every day, and there's always reminders all around me. They're like, oh, well, you can't do this anymore, or, you know, you're not proficient in this ability anymore, or you can't do this, you can't do that. And it feels like I just have to settle for 5th place when, you know, all of this stuff that I used to be able to do, like I knew I could do it, you know what I mean? Like I could do it.
Yeah.
Because I did it, you know, before, and now I can't, you know, because I have all these physical limitations on me, you know. And like a lot of people that I talk to about this don't. So, and you know what? It's not their fault. Because how could they possibly, you know, like how could they possibly know? You know what I mean? I can't expect everybody to be emotionally sensitive to this. You know, like I can't expect that from every single person. As much as I'd like to, you can't expect that from everybody. And I get it, you know, like how can they understand it's not them it's happening to, you know? But still, it still doesn't take away the feeling of grief that's the that's the that's the word I would use to describe this. You know, like the grief over like the death of me. You know, like it's the death of
Yeah.
myself.
That's a really good way to put it. Kind of like your old self, and then you've had to
Right.
adjust to this kind of new reality. But obviously, you're dealing with it. But
And this is not even the first time it's happened. You know, like when I
yeah,
got HLH, it felt like it was over. You know, and then I went through chemo, and the chemo was so bad, and like it felt like that was the death of me before, and then after the chemo, I felt like I could get back on track,
right.
and then my kidneys started to fail, and then it's just like again, I have to like mourn the death of who I used to be, so I can't. It feels like I can't get back, you know. So
The kidneys, like, did they think it was from diabetes that the kidneys got worse, or?
it was kind of like the perfect storm. Like I was a diabetic, and I was trying so hard to like maintain my blood sugars. And then when I got sick with the HLH,
you
they
had to
had
be on steroids, of
yeah,
course.
and
Yeah.
like my blood sugar just it went like through the roof, like it just skyrocketed, and I couldn't keep it down. And you know they were giving me insulin, but it didn't matter because I was on all the drugs. You know, then I was on the chemo, and then after that, after like everything cleared, it was just like after I was off all the drugs, it's just my kidneys just declined like so quick, and like I didn't understand why, because it's like you know my blood sugars weren't you know like they were going back to normal after, and it's I don't know what happened, and then next thing you know it's just stage 5 renal failure, just all of a sudden, and it's like I didn't know it was gonna get this bad. Like I knew that I had like you know I knew that I was in stage 3 when it started,
Mm-hmm.
then stage 4, and then stage 5, and it
was pretty quick.
yeah it was fast. Like I didn't even have time to like mentally prepare myself.
Yeah.
It was just, well, you have kidney disease now. Okay, bye. You know, and I'm like, well, what am I supposed to like? What is there any support groups or anybody I could like talk to on my own on this?
Man, yeah, you just you got dealt a very bad hand with 2 huge things, and
Yeah.
then especially just back to back too. You didn't really have any time in between.
Yeah. When I was a kid, I also had Steven Johnson syndrome. I had that.
From a sulfa drug, right?
Right.
Yeah.
That when I took it, that's what happened. Like they didn't know. You know what I mean? It's not their fault. Like
Yeah, but you had this obviously very severe reaction to that.
right. But they couldn't have possibly. It was the first time I had ever been like admitted to Kaiser, so there was no way they could have possibly known.
Sure.
So they just gave it to me thinking that it was going to help, and then. You know, 3 months later, I was still at the hospital. I was there for 3 months, so like 3 months later, I was still at the hospital.
Oh my god.
Yeah.
In your family, like I saw you fill this out, like your mom is still living.
Yeah, she's right in the lobby.
Oh, she is. Okay,
Yeah,
great.
breast cancer survivor.
Oh, okay.
So it's just like, man, my family sucks. So she's a breast cancer survivor. She had the mastectomy. Yeah, so she had that.
Anyone else in the family, like, with any other medical issues?
As far as my dad, because it's just like you mean like in my mom or my father or
Parents and siblings.
my sister, she doesn't have any like she has like a mild case of ataxia, you know, but aside from her just like making poor life decisions, she doesn't have any like medical problems like I do. My mom is a breast cancer survivor, and with my father, even if he did have something, like he wouldn't tell anybody, so like
Okay.
I wouldn't know. You know, he'd be like, "Yeah, I'm fine. Are you sure about that?" Yeah.
Okay,
Like,
so he's not
okay,
gonna. Okay,
yeah, right.
he's
So
not
even
gonna
if he
talk
had
about it.
something, you know, like he wouldn't know. Maybe he has diabetes. I don't know. He might like try to like lie to me about that. Like, I ain't got no diabetes. You know, picks up a beard and like, okay, all right, you're fine, okay. But as far as like that medical history goes, like
Nothing
it's
else.
yeah, it's just like I think I'd say cancer. Because my mom's sister, she passed away from cancer.
What kind of cancer did she
I
have?
think it was breast cancer. But like, as far as like the HLH, like I think I might be the first one, like in our family with it.
And when you were diagnosed with the HLH, did they talk about something that they thought had triggered the HLH? Because lots of times it's secondary to something else, like an infection or something else. Like, I didn't see that they had identified a particular cause, but I was curious if they had suspected anything when you were first diagnosed.
I think they might have mentioned, because like at the time I wasn't, like I was out of it
Sure.
at the time.
No.
Yeah, but they might have mentioned an infection. They thought, but they couldn't. From my understanding, is that they couldn't pinpoint a point of origin.
Right.
So it's like something happened, and I just got sick.
Sure, and
So-
it triggered this like inflammatory response.
Right. But they couldn't like pin it down to like an exact like point of when it started. It just
Okay.
one day, and it came up on me. I don't know. Like I guess looking back on it now, like hindsight is 2020. Like I sort of I should have seen it before it happened. Like one day I just got sick for like 3 days. I was just out of it for 3 days, and then I felt like something was wrong, and then I drove myself to the emergency room, and then I was there for like 30 days. So I went in there, and then I didn't.
You didn't get to leave
Right.
for a while.
Yeah.
No, it sounds like you were pretty sick at the time, and that's usually the case when someone's diagnosed with HLH, is they can be very sick before kind of getting things under better control. But currently, you're not feeling any of those sorts of symptoms, like no fevers, chills.
No. No fevers or no chills. Once I started, I think that I did get them. Like after and my kidney started to fail, I did started getting like the chills, and I started getting a fever. But once I started on dialysis, they stopped.
Okay.
So I think I contribute that to the kidney disease.
Yeah.
Of like my kidneys not working. So.
Do you feel short of breath at all, or any?
No, it's not like no spontaneous short of breath or anything like that. But like when I exert myself, it's much more difficult now than before, because I've been without, I've been without training for so long. So
Sure.
like I don't have like a cardio or anything like I used to have.
So you might get winded more easily than in the past when you were
I get a lot
training
more tired. My blood pressure drops when I stand for long periods of time. Yeah.
Okay. And have you ever needed a blood transfusion related to the kidney disease, or have they been giving you any treatments to try to raise your hemoglobin levels?
No blood transfusions, though I have had blood transfusions before with the chemo. But no blood transfusions, but they do give me Procrit shots inside the machine. So I do get, because I do suffer from anemia, like most people would with kidney disease.
With kidney disease. Are you getting that like once weekly, or?
I think I get it once a week. Once a week.
Okay.
To keep my my hemoglobin up.
Okay.
Yeah.
Okay. Do you know, like, I saw some lab work from Dr. Powers, but it's been a few months. Like, are the kidney doctors keeping track of your labs? Like, I'm assuming through the dialysis clinic and stuff?
Yeah. There's a nephrologist that visits the clinic. He visits every once in a while. Not every once in a while, but he visits regularly. And he, what they do is they draw regular labs off me. And then, that's how he sort of can tell like how my progress is going on dialysis. So yeah, they do that.
Okay. And do you have a graft or fistula for dialysis access?
It's in my arm. Yeah.
Okay, sounds good. Do you mind having a seat up here?
Yeah, sure.
Take some deep breaths. transferred normally? So you said in March they're gonna do more workup as far as the transplant goes?
Yeah, they're actually gonna start the workup. Because
Okay.
I was trying to get a workup before, but like UC Davis sort of, I'm not UC Davis, I'm not UC Davis, but I'm talking about as far as like CPMC, and like sort of UC Davis, I sort of got ghosted a little bit, you know?
Yeah, because I was wondering, because it looked like, you know, you had seen the transplant doctors here back in July, but then I wasn't sure what was going on in the
Like
interim period.
I didn't get any reply for that whole time.
Yeah.
So like it wasn't until, you know, I started making phone calls is when like I started making phone calls. Like I just took the initiative myself. Like nobody's helping me with this. You know, I'm doing this myself.
Yeah.
Like I'm
No,
talking
it's a shame.
to like transplant coordinators, and I'm talking to, you know, like I'm doing all the footwork myself. Like I'm getting no help, and you know, and it's like I just started on dialysis. You know, like I feel like this is something that I should have already been listed. You know, and then I guess the transplant department here sort of shut down for 2 months. I didn't know, so I'm calling from December till now. Like I called like the whole time in December, and like I didn't know. Like if I would have understood if they would have just told me of like, hey, the clinic's shutting down.
Yeah, it sounds like there definitely should have been better communication about, you know, whatever was going on. I'm assuming probably with COVID there was some issues with that.
But I understand, you know what I mean? I'm not their only patient, and I understand that, you know? So, like, I can't sit here and get up, you should have told me. Because I'm not the only person they see, you know? Like, they see thousands of people. I'm just, like, one person out of, like, a million people they see, you know? So I can't expect them to call, like, every single person. I understand that. But I will say that I have talked to the transplant coordinator during that time when they shut down. She could have at least told me, you know? Like, hey, we're going to shut down. Hey, we're shutting down because of COVID. You know, like, you might not be able to get in contact with you.
Just, like, to make you aware. I'm going to have you lie back.
Okay.
Are you okay?
Yeah, I'm just real sore.
Are you sore all over or in a particular place?
It's just kind of all over. Like, I went to do a little training on Saturday. And then, like, I pushed myself a little too hard. And then dialysis didn't go so good. So.
Yeah, I was going to say the dialysis session also, you were saying.
Yeah.
Could you take a deep breath in?
Oh, man. Wait.
Yeah, like inhale and then let it out. Okay. One more time. Okay. You can sit up.
Who gave you the referral to here to see me?
So our, like, when a referral comes in, our new patient coordinators assign it to a particular provider. So I think Dr. De Silva, who's one of your doctors, is the one that had put in the referral originally, but I'm not sure how long it took to authorize your insurance and everything before they actually assigned you to my clinic today.
Because I remember they were saying that originally when you know, the first time I got saw here in July, they were saying that I couldn't be seen by a specialist here because, like, my insurance didn't cover it. So
yeah, that's what I was wondering about, because it looked like there was some issue with the referral, but I don't know if they got, like, sometimes they have to appeal to your insurance and then they approve it or something, so I'm not sure if that's what happened in this case. Mm-hmm. You can have a seat back over there. Yeah. But in your case, it's also like, I mean, I know you followed closely with Dr. Powers, so
right.
She's the one that knows your case best, but I think maybe just because your transplant doctors are through Davis, they also wanted you to be seen here.
Right.
Yeah.
Which I don't have a problem with. It's not, you know.
Yeah, but I mean, I'm kind of. I talked about your case with a couple of the other providers here too, and
Oh, really?
I mean, yeah, because a lot of times we kind of talk as a group about cases, but I'm inclined to agree with Dr. Powers. Like, if you haven't had any signs of, recurrence of the HLH up to this point, and then you've been off of immunosuppression for over a year now, I think one of the things the transplant doctors wanted to know is like your risk of relapse as far as the HLH goes, which obviously it's hard to predict if someone is going to relapse or not. But the highest risk of relapse is kind of within 1 year after someone completes HLH treatment, which you're past that point now. So the chances, I mean, there's always still a chance, however small it may be, but it is less than someone who was closer to finishing treatment. So that's one good thing. What I did want to do was, if you're okay with it, get some lab work here today, just checking some of the parameters that we monitor.
Yeah, absolutely.
Yeah, just so we have that in our system and, we can make sure that we don't really see anything out of the ordinary. But based on the labs that you've done a few months ago for Dr. Powers, it looked like things were pretty stable. So hopefully it'll continue to be the case. But from our standpoint, I don't see a reason why you shouldn't be able to proceed with the kidney transplant as far as your history of HLH.
Okay, that sounds good.
Yeah. If there's something that comes back unexpected on your labs, of course, we can talk about it in more detail and see what we would need to do. But hopefully your lab work will just be stable like it was prior, and we don't necessarily need to do anything different.
So from your have you ever seen anybody with HLH? Like you personally?
I have, yeah. I've seen it in the hospital, not as much in the outpatient world, but yeah, we've treated some of the patients on the same protocol that you were on, the HLH-94 protocol, the etoposide and steroids and all of that. So
they were kids, huh?
No, they were adults as well.
Oh, wow, okay.
Yeah. HLH is an interesting disease just because the presentations can be a little different, but of course it's like the clinical criteria that you have to meet to kind of diagnose the illness. But yeah, you're the first person I've seen in the outpatient setting like that's kind of completed all of the treatment for HLH. It's not a very common illness, as you've probably read about. So.
Right. Because I do a lot of research about it. And it's very uncommon. It's even more uncommon in adults, right?
Yeah.
Mostly a child disease or adolescent, like babies, children.
Yeah, and that's especially like we kind of divide it into the primary and secondary HLH. So primary HLH we see more in the pediatric population. That's why I was kind of asking you if they had found something that had triggered it, because in your case it sounds more like a secondary HLH.
So it's acquired. So one is like genetics and one is like genetic. Yeah. And then one is like acquired.
Right. So like sometimes it's related to a rheumatologic disease or an infection or some type of like cancer even can trigger it sometimes. So
that I have heard. I have heard that there are some like you can transition in HLH from like a cancer. I have heard that.
Yeah. But in your case it doesn't sound like they did a bone marrow biopsy which didn't show any sign of cancer or anything like that. Yeah. And sometimes I think it's also hard to determine, like in your case, it sounds like they were suspecting maybe an infection, but they weren't able to identify specifically what. So. Yeah, so I think in terms of next steps, like if you can get the lab work done at your convenience, it doesn't need to be fasting or anything.
Yeah, I can do it today if you guys had the facility available. I can get it done today.
Yeah, it's actually in this building on the first floor. We have a lab, so I'll put in the orders and you just go to the lab and they'll be able to draw it today. And then the kidney doctors, it sounds like, are going to start your workup in March. So if they have more questions for me, they can always contact me, but they'll be able to see my note today, like, that we spoke. And at least from my review of your case and everything, I don't see a reason why you shouldn't be able to move forward with the transplant process.
Okay.
Do you have any other questions or anything else I could help with?
I mean, no, not really. Admittedly, I was a little, I don't know. I was a little trepidatious about like what news I would get as far as this,
Yeah.
It's like, admittedly, I'm a little, I'm running a little bit dry on like hope these days.
I get it. No, I get it. But I think from what I've read from Dr. Powers' notes, it sounds like she's done a really good job managing everything for you. So I don't see anything that makes me disagree with her opinion about things.
Yeah, but I mean, it's, if it sounds good, then like I trust your judgment. So
yeah.
So it's one less thing to have to worry about.
Sure. And like I said, I mean, if the kidney doctors have more specific questions that they want us to address, I'm sure they'll get a hold of us. But at least from reading what they had said in their notes, it sounded like they were just kind of asking more about prognosis-wise with the history of HLH and everything.
So, what's your last name? How do you...
Datta? D-A-T-T-A?
Datta?
Yeah.
Okay.
Yeah, it's spelled like data, just with an extra T. Yeah.
You're so young. How long have you been a doctor for? You can't be that much older than me.
I'm not older than you, actually, but yeah. So I did my...
Well.
Yeah.
I feel old now.
Similar ages. Yeah. No, I've been at UC Davis for 6 years now. I did my internal medicine residency here, and then right now I'm in my hematology oncology fellowship last year. So
So what happens after this for you?
So I finished fellowship in June, and then technically I guess I have to get a real world job. So yeah, so I'm not sure exactly where I'll be after June, but kind of looking for jobs right now.
So you're sort of doing your residency here?
Yeah, it's sort of like fellowship is kind of the subspecialty training after you finish your general residency. So
are you gonna stay here, or are you gonna try to see if you can
go elsewhere?
Uh-huh.
I wouldn't mind staying here. I do like Davis a lot, but it kind of just depends if there's positions open or not. It's, as you know, I'm sure, especially with COVID right now, it's a little bit harder with hiring. So
right,
just looking around. Yeah.
Because I spoke to my vascular surgeon about my graft. I spoke to her a couple of days ago. And she was saying that she used to be here.
Oh, yeah. Cool. So she must have done her residency and stuff here.
Mm-hmm, mm-hmm. And then she sort of transferred over to what she does now in Fairfield. So
yeah, I'm hoping to stay either in Sacramento or the Bay Area. So kind of looking in that general location right now.
Mm-hmm. So once you start with where you are right now, are you gonna stay with this? Are you gonna stay with hematology oncology?
Yeah, I'm specifically in hematology oncology. Those are the only types of patients that I see. You can kind of subspecialize more within hemononc just because there's so much and always new treatments coming out. It's hard to keep up with everything, but it kind of depends on the job I end up getting in terms of if it's an even more specific focus or not.
Mm-hmm.
Let me just make sure I put in the lab orders for you so that you can get those done today.
All right.
And then in terms of follow-up with me, like, I don't think you need to necessarily schedule something with me unless the transplant doctors want you to see me again about something. As long as you're continuing to follow up with Dr. Powers. Like, how often is she seeing you?
I see her every, I just recently started seeing her every 4 weeks. It was longer than that, but like every 4 weeks I sort of schedule to speak with her.
Okay, great. So
if you ever get a chance to talk to Dr. Powers, she's a really nice lady. Like she's really nice. She's fun. She's funny.
Oh, that's great.
She's
yeah.
great. So if you ever have to like communicate with her for any reason, like you don't have to be worried. She's not like a curmudgeon. You know.
Okay. No, that's good to know. No, I have not had the chance to work with her before, but I'm glad to hear that she's like
she's
a
awesome.
good person to work with.
Yeah, she's very forthcoming with information and helping me and things like that. Yeah.
That's good. Especially through the whole process, it's nice to have somebody like that in your corner for sure.
But now after meeting you, and speaking with you, I can put you on that list as well.
Oh, thank you. That's a very nice compliment. All right. Okay, so I've got these lab orders in. And then just let me know if there's anything that I can help with. I wish you luck with the workup and everything for the transplant.
Mm-hmm. All right.
All right. I can show you where you can check out.
Okay, yeah.
Yeah.